Good morning, everyone, to the April Los Altos Chamber of Commerce Government Affairs meeting. It's so good to see so many faces. Um, we are going to go ahead and get started. We have two really wonderful guests with us today, and then over a really interesting and important conversation to have regarding Narcan and most importantly, fentanyl in the county. So we are going to start with introductions, saving our guests for last. So like usual, get ready for pop-up bingo introduction style. So hover over your unmute button when you're ready to go. We're going to go with myself. I'm Diana Batista. I am with Lucille Packard Children's Hospital Stanford and a member of the board here at the Los Altos Chamber. Next, we're going to go to Marie.
Good morning, everyone. Hi, Joe. It's Marie Young. I'm an individual member of the Chamber of Commerce. Thank you, Diana.
Thank you. Michael Murphy.
I have a granddaughter who's in the Los Gatos School District, and every time I meet with her, I say, have you done the Narcan training? Do you carry it? And I suddenly realized I need to learn about this. So I'm a Rolfer in town and member of the chamber, and I'm going to learn about Narcan today.
Great. Mimi.
Ginny, I'm Ginny Lear. I see my name here twice, so I don't know. I am resident of Los Altos. Good to be here and learn about Narcan.
Thanks, Ginny. Mimi.
Good morning, everyone. My name's Mimi Lee, and I'm currently serving on the Chamber of Commerce Board of Directors, and I've been a longtime business owner since 2007 of Curves, of which I recently sold. So I'm currently looking for a new job. Hello.
Mark.
Good morning. I'm Mark Seidel, and I'm on the board of the chamber. I also work with a local family foundation.
Scott.
All right, good morning. Scott Hunter. I'm the executive director of the Los Altos Village Association.
Kathy.
Morning, everybody. Kathy Lara. I'm on the Chamber's board and also a new team member at KMVT Silicon Valley Community Television.
Woohoo!
And thank you, everybody, for all your support. I appreciate all the encouragement and cheerleading that you've given me the last several months. Thank you.
Holly Ann.
Good morning. Just in time for me to get my coffee. Thank you. I'm Holly Ann Vickers. I'm a colleague of Mark's, actually, and here at his invitation. So thanks for having me, everyone. I work in Los Altos, and I'm calling in this morning from San Francisco. So
well, thanks for joining us.
Topic. Yeah, thank you.
I have to ask, are the plants real?
No.
No.
Really virtual, yes.
Thank you.
Kalita.
Hi, everyone. Good morning. I work for Supervisor Simitian, and I staff him on press and outreach primarily.
Well, thanks for being with us.
Thanks for having me and us.
Kelsey.
I knew that was coming. Good morning. I am Supervisor Simitian's Chief of Staff, and I wanted to take part in today's training and join all of you.
With us, Joe. You always have a good team, Joe. I always admire that about you. And Jasmine.
Hi, my name is Jasmine. I'm a community worker for Scoop. I work with Anjanette.
Awesome. Thanks for being here. Abby, do you want to introduce yourself?
Might not have heard you, Diana.
Abby, are you there? Are you able to introduce yourself? All right, that's okay. All right, we are going to go ahead. And then without further ado, we have Kim, of course, our president and CEO of Los Altos Chamber. Thanks, Kim.
Sure.
And now, without further ado, I really want to introduce our wonderful supervisor, Joe Simitian. If you don't know Joe, look him up. But if you all do, we know what kind of a great leader he is and all the wonderful things he's done for the county and for the state. When I first met him, he was in the Senate. So we've gone a long way, Joe, and it's just always good to see you. So we are going to go ahead and start you off, Supervisor, so you can set the tone for today.
Well, thank you all. And if I can ask Anyone who is hearing me loud and clear to give a thumbs up, just so I know that, all right, we're good. Thanks so much. I am County Supervisor Joe Simitian. Many of you are friendly and familiar faces. The others who are newer to me, it's a pleasure to meet you all, even via Zoom. I wanted to be with you this morning because, well, some of you may be aware, I suspect many of you have not been aware that our county has had an ongoing effort to make naloxone, or Narcan as it's known by its brand name, available at various venues throughout the county, and to train our own staff on how to administer Narcan. And I think it's a particularly worthy effort because opioid addiction and abuse is a problem that affects communities up and down the peninsula and throughout the South Bay. And, you know, perhaps because the fentanyl epidemic got to our part of the country a little bit later than other parts of the country, not everyone has been quick to understand the magnitude of the problem. But it's clear that fentanyl is right here and right now, and it's deadly. And I want to just share a sort of a personal experience I had. I really became a little more familiar with this whole issue for the first time, oh gosh, more than half a dozen years ago now. Back in 2017, I traveled to 3 states across the South and the upper Midwest, and I was talking to a small town mayor in Pennsylvania. And when I say small town, you'll get the gist when I say it was not only the mayor, he was a volunteer firefighter, as well as being a local dentist, if I recall correctly. And in his role as a volunteer firefighter in the community, he was concerned because he was telling me that they were seeing the problem of fentanyl so frequently that they were literally concerned they were going to run out of Narcan in their small town, that they just couldn't keep up with the demand for the supply. Now, at the time, again, more than half a dozen years ago, fentanyl had not yet become a major source of concern here in California, at least not in our area. Back, you know, middle of the last decade, let's say 2015, the number of deaths attributable to fentanyl in our county was, you know, probably in the single digits. And while each of those lives lost was obviously a tragedy, it didn't garner that much attention in a county with 2 million people, quite frankly. But just a half dozen years later, after, you know, numbers sort of hovering there in the single digits, we were looking at more than 160 deaths in our county as a result of fentanyl overdoses. So the growth has just been very dramatic, very, I would call it extraordinary. And I want to underscore, since we're, you know, in Los Altos today, that this is not just the larger cities. This really is a problem that also affects our smaller and relatively prosperous suburban communities. I sometimes have to, you know, remind folks that this isn't just a San Francisco or San Jose or Oakland problem. I suspect some of you have actually heard about the deaths we've had right here in the North County and in the West Valley communities that I represent. And I should just mention, I've heard some of the parents who've lost a loved one to fentanyl, and it just really does break your heart. I mean, so that's why I say the problem is real and the problem is here, and it is a deadly one. I've done a number of these trainings and workshops now around fentanyl awareness and education in my district, because I think the issue is an important one, and I want to, you know, lend my own support to the county's larger effort. As we've talked at the county about making sure that we have Narcan available at every college and university and high school and community library that wants it here in the county, we've also been looking for additional venues, and like this one, and where we can spread the message and distribute Narcan to those who take the training. And I will just say, I think the business community seemed like a natural fit to me, because in a very real sense, I think you all are also on the front lines. I should underscore, because I know people are sort of like, is there anything I can do about this? And the answer is, yeah, this is an avoidable problem. And under the right set of circumstances, it can even be reversible. And I want to use that word again, reversible. And we'll hear a little bit more about that in a minute. And that's why folks are being encouraged to get the training and to have Narcan readily available, you know, at home or their workplace. I have a Narcan kit literally in the console of my car. When I said reversible, I saw a couple of faces that looked quizzical. And I should just tell you, over the course of a year, we have had 650 overdose reversals. So folks who had overdosed, but were able, using Narcan, to reverse that overdose, that were self-reported to our county. We know that sometimes folks in the community question whether this can really work, and that's why I always want to be able to remind them that we've got 650 overdose reversals that were self-reported to our county's harm reduction program. So literally 650 lives saved through the use of these kinds of overdose prevention supplies. It really can make a difference. It does. And most importantly, there is something that you all can do. So thank you. I hope you take advantage of the training to learn a bit more. And then be sure to ask Anjanette, who I'm going to introduce in a moment. Be sure to ask Anjanette for a Narcan kit, which can be made available free of charge. And then hope that you'll never have to use it, obviously. With that, I would like to introduce Anjanette DeVito. Anjanette's our nurse manager for the county's Addiction Medicine and Therapy program. We, of course, have an acronym, AMT, where she manages the day-to-day operation of both the adult and youth clinics and handles referrals for treatment and direct patient care. So she really is very much day-to-day, hands-on, confronting these challenges. And she's also the education chair for SCOOP. You heard the reference earlier from one of the attendees, the Santa Clara County Overdose Prevention Project. And she handles all of the coordination and training for that program. I should also mention she has been a nurse for 31 years and has worked with our program for 30 years. So she not only is day-to-day and very hands-on, but she's got just years and years of experience. So this morning, Anjanette's going to tell us more about the dangers of fentanyl and opioid overdose more broadly, and then train us on how to administer Narcan. So let me thank her for making herself available yet again. And again, thank all of you for taking the training. And please do make sure you take advantage of the opportunity to acquire Narcan. If we were all in the same room together instead of virtual, we would literally hand it out to you on your way out the door. But it is easy enough to access, as you will soon hear. Anjanette, thank you. Let me turn it over to you.
Thank you so much, Supervisor Simitian, and thank you to the Chamber for the invitation to share, this information with you. It's always a pleasure and a privilege to be on the left or the right side of Supervisor Simitian when we do these things. He and I, as he shared, have done many of them over the last, I think it's almost a year now that he and I are partnering with this. So I'm always grateful for the opportunity to talk about this. And as the supervisor said, we can make arrangements for the naloxone either to be delivered directly to the chamber, where you can pick up the kits, or we can mail them directly to you. It's up to you. And Diana, you can tell me whatever's easier for the chamber and its members. We'll do whatever that is. So with that said, let me share my screen. Actually, Diana, I think you have to let me share my screen.
Actually, Nicole, are you able to help me?
Someone has to let me share. I'm not always a good sharer, but today I can be.
There's the Kudo dogs. Time 9:16. Good job, Ginger.
Okay. So while we're working all that out, as the supervisor said, I've been a nurse going on 32 years in June.
Yeah, she should.
And most of my adult career has been spent here in addiction medicine. So I've seen a lot of changes over the course of my career. And this is by far one of the most impactful things, I think. Yes, the pandemic was impactful, obviously, because it's day-to-day healthcare, but this, I think, has been essentially the same sort of impact, because this affects people at the core, the core level. Okay, so now let's see if I can share now.
Yeah, it should be working now. Give it another try.
Okay. Sure. Let's see. we don't use Zoom very often here. We're more of a Teams group. So I'm hoping you can see it.
We can, yes.
Okay, perfect. So again, that's me. I work for Addiction Medicine. It is a program in the Substance Use Treatment Services division of the Behavioral Health Services Department of Santa Clara County, which that's a fairly new partnership, but it works really well for us. So generally, the first place that I like to start when we talk about this is understanding the law around naloxone. It is a prescription medication, but it is not on the controlled substance list because it is not a scheduled drug. And that's important because while sort of twofold, while you do sometimes need a prescription, and I'll explain why we can give it out in a second, it's not on the controlled substance list. We are allowed to distribute because there is a state standing order from the state's public health department chief, Dr. Smith, that says we are allowed to distribute to whoever we need to under that state standing order. So essentially that is the prescription. It can be prescribed by anybody who has prescription writing privileges. So doctors, dentists, veterinarians, anyone who literally can write a prescription can write a prescription for naloxone, or you can just call us and we'll just give it to you. It can be administered by anybody to somebody in a crisis. So while I think we are all special, you don't need special letters after your name like RN or LCSW or MD or anything like that to administer naloxone. You just have to be willing to help somebody when you don't know why they're unresponsive on the ground, right? Or in an office building. You just have to, be willing to do that. And then California has additional liability protections in place in addition to the Good Samaritan Act that protects both the prescriber and the person who deploys the medication from being sued criminally or civilly if the outcome is less than what we expect. And we expect that when there's an opiate present in the person you are resuscitating and naloxone is given, that a reversal occurs. If for some reason that does not happen, you cannot be sued, criminally or civilly for that. And that information came directly from County Council, as well as the Assistant District Attorney in Southern Santa Clara County, Adam Flores, and in the Northern Santa Clara County, Ed Liang. So
Anjanette, do you mind if I interject with one question along those lines? This is Kim Mosley, President of the Chamber. Is that typically the condition in most states now? So as we have, like my daughter's going off to college in the fall, if she's trained and has a kit and goes to New York State, is that also very likely everywhere else, or how?
Yes. Okay. There is a document, Kim, let me see where I have it. It's like I have it somewhere and I can email it to you. It's a 700-page document and it's called LAPA, L-A-A-P-A, and it outlines all of the additional liability protections that are in place for every state in the United States.
Okay.
So they vary a little bit between states, but by and large, they're predominantly the same. And so I'll email them to you, or perhaps I can email them to Kalita and Kalita can send them out to you, if that's okay with you, Kalita. So absolutely, but by and large, there is legal protection in place for people who deploy when something else is going on. How do overdoses happen? When you got up this morning, 3 of the most important body systems that you have are your brain, your heart, and your lungs. And when you got up, they all worked dependently on each other. The brain tells the heart to beat. The heart tells the lungs to expand and contract, moving air and oxygen through your body, right? It's a homeostatic situation. Carbon dioxide levels are equal, oxygen levels are equal. When there's large amounts of opioids on board, carbon dioxide levels increase and oxygen levels decrease, causing unconsciousness, coma, and death. What we want to have happen is bringing those, and they stop working dependently, they start working independently. So we want to bring them all back to working together. That's where naloxone comes in. Naloxone brings those 3 systems back together. The brain tells the heart to beat, the heart tells the lungs to expand and contract, moving that air and oxygen, and they come back together and everything becomes even, okay? And when, so carbon dioxide levels will start to increase, oxygen levels will increase, carbon dioxide levels will decrease, and we'll go back to a homeostatic situation. And to explain my point further, these French fries on your screen are your opioid receptors, right? They take in all of the opiate that you might be taking if you're having pain from surgery, from a dental procedure, from whatever you're using it for. It's a cup. and it's called a mu receptor, MU, and it lives in the front of your brain. Okay. And when you take that opioid, represented by the green P, it sits inside the cup. And now the receptors of taking that medicine, absorbing it, and sending it wherever it needs to go. When we introduce naloxone to the situation represented by the blue raspberry, it has a stronger affinity to the receptor, so it kicks it off. The receptor flips itself over, and now the only thing the receptor is absorbing is the naloxone and not the opioid. And that's how we get back to a homeostatic situation where oxygen and carbon dioxide are even to each other, okay? So when we started talking about this, we had to talk about who is at risk of overdose, where, why, and how, right? Kind of the big questions of it all. What we've learned over time is that opiate use, opiate overuse, opiate overdoses do not discriminate. They don't care if you drive a Range Rover or a Toyota Prius. They don't care if you live in the southern Santa Clara County or the very northern parts of Santa Clara County, which are more rural, versus living in something, somewhere very urban. It doesn't matter, what race or nationality someone is either. It affects all of us equally. People who use opioids for pain control, they are at risk because when a pain medicine is prescribed by a doctor, it's prescribed a certain way, right? 1 tablet every 4 hours or 6 hours, whatever it might be. But if you let pain get out of control, meaning not taking the medicine the way it's prescribed, you need more of it. So when 1 tablet would have worked, but now you've waited so long, now it takes 2 tablets to manage the pain, or 3 tablets. And so that's where we sort of get out of control there a little bit. Our elderly people who potentially live alone, but someone comes in and fills their pill organizer for the day. And so they will take a dose of medicine, they will go on about their day, they come back and they think, oh, I forgot, and they take it again. It's an accidental overdose, but it's an overdose nonetheless. Our young people who are experimenting, and we know that they do that in places, that are unobserved or unmonitored by adults or, people on campuses and different places. So school bathrooms, restaurant bathrooms, unmanaged or unmonitored classrooms and concessions areas, and anywhere in businesses or buildings where there are not people. So that's something to pay attention to. Those who have drug dependence. So if a person who's drug dependent versus someone who's drug addicted, a dependent person can take the medicine for a period of time and then they stop. And so their tolerance will change. But when they go back to it, they don't think that their tolerance has changed. So they start taking the same amount that they were previously. And, there's a problem there. Someone with drug addiction, they take the same amount of medicine all the time, right? So there's that level there of sort of safety, if you will. The opiate naive. An opiate naive person who is someone who never took an opiate ever before in their life, regardless of their age. You could be 6 or 60. If you've never had dental work, a surgical procedure, whether inpatient or outpatient or anything like that, you would be considered opiate naive. Now, the problem with that is we are literally taking a prescription and we are sending you home with it. And we're saying, okay, you take this tablet 1 every 4 hours, but we have no idea how you're going to react or respond to that medicine. So you could have a sensitivity, you could have an allergy to it, and that becomes problematic. Our long-term drug users who have spent some time, again, with abstinence, where tolerance changes, in county jails, in state prison systems, in our local custody facilities, in long-term or inpatient drug rehab centers, in hospitals, long-term hospitalization, and when medications are mixed. So if you mix a medication, one, let's say, is a respiratory depressant, means it slows your breathing down, versus one that speeds up your heart rate, like methamphetamine or an amphetamine product, the body can't do 2 things at once. So it can't speed up your heart and slow down your breathing. So it just stops. And in that case, that's how the overdose is happening, right? Because the system can't do 2 things. And the why? Why? Well, because people mix medications, or they potentially use alone. They have physical health issues like respiratory illnesses, asthma, chronic obstructive pulmonary disease. They have decreased immune systems due to HIV, AIDS, cancer, chemotherapy, lupus, diabetes, something along those lines. They may be malnourished, whether it's food insecurity or they have a digestive illness, right? They may have an ileostomy or colostomy. Their intestines aren't working. They've had, some alteration to their digestion. They're chronically dehydrated. If you have enough dental work, you will permanently alter how you taste things. So in that case, someone who has this dental work, right? They taste something that's metallic or bitter. They tend not to drink water because they can't manage the taste. So they'll opt for something sweet or sugary, and that leads to chronic dehydration. Your body can't metabolize the medication effectively if there's not enough water in the system. So it can either speed up the digestion or slow it down, meaning the medication stays in the system longer, leading to an unintended overdose. Those who struggle with weight loss, whether it's anorexia or bulimia, gastric bypass surgery, or some other weight loss surgical procedure, again, other issues with digestion, and those who struggle with cardiac issues, heart attack and stroke. So you can see from that list, most of us fall into potentially one of those categories. And so that's something that we will look at in terms of medicine and how we prescribe. And there's been a lot of work done by the physician clinical lead at Scoop to do re-education and retraining for the providers who prescribe. So safer prescribing practices have been in place. It's much more rare to get an opioid prescription for 30 days with 3 refills. Prescriptions are really being limited 3 to 5 days unless there's something, really tremendous going on for people, because we're trying to, to take into consideration the long-term effect of being on chronic opioids. Now, the how and the where is this slide. And this slide was provided to us by our DEA, or our Drug Enforcement Administration, in collaboration with our Assistant District Attorney's Office and with County Council. This is the Snapchat profile of someone allegedly who was selling drugs on Snapchat. So the where is social media, direct messaging, Snapchat, Instagram, Twitter, Twitch, direct messaging, any other of those platforms that I'm probably too old to know anything about anymore, but here we are. So you can see from this slide, this person had Percocet and oxycodone for sale, right, based on the emoji he was using. If you look right here, this is how much his product cost, and the little $ with the bag, I equate to like OpenTable. When I use OpenTable to make a dinner reservation, $1 is not a very expensive restaurant. $2 is a mediumly priced restaurant. $3 is I'm not really going there except maybe on my anniversary or for Christmas. So that's what he was saying, essentially, is how much his his product was costing. The other thing, he had cocaine and he had methamphetamines. This chocolate chip cookie refers to a large batch. When we talk about chocolate chip cookies in a second, there's something called the chocolate chip cookie theory. And it's about where opioids show up. And we'll talk about that in just a minute.
And Jeanette,
yes.
Can you make this image larger?
I cannot, but what I can do is A, send you the presentation, and B, send you the link to the slide.
Perfect.
Will that be helpful, Michael?
Sure, that'd be great. We also see your notes on the left. Maybe if that went away, it could get larger.
I don't know if it does.
Okay.
But let me
Jeanette,
see.
It's
Yes.
very simple. If you just move your cursor down to the lower screen of your PowerPoint, there's a little icon that's like to the right, lower corner, next to that slide. Yeah.
Like that?
That's one way, but the other one is see the little that little rectangle to the left of that?
To the left, rectangle.
Click on that. It's like a projector screen.
Oh.
Go to the right.
This one.
This one. Click.
Okay, I don't think it made it any bigger.
So now,
now
we just see your presentation without
Oh,
your notes on this, but you can still use that sliding scale to enlarge your picture.
Yeah, Yeah, I don't think it, I don't think it.
Don't worry too much about it, Anjanette. Everyone else can also Zoom on your own computer. You can enlarge it on. That's what I've been doing, was like enlarge it on my screen. So, but don't worry about that. We have 25 minutes left. So I want to make sure we get through the presentation.
We'll be done. We'll be done, no problem. But I will still email it out to you and send you the links so that you have it. Okay. So this slide was done in collaboration with 3 public health campaigns that the Santa Clara County put together with our public health partners. One Pill Can Kill, Fentanyl Takes Friends, and One Pill Can Kill, Fentanyl Takes Friends, and there's a third, and I'll remember it in just a second. But those were, you will see those signs on buses, on billboards. There's on our website, there are resources. There are things that, you know, can be put in business windows that say, you know, Narcan available here, if that's something, you know, that you want or you need to have, things of that nature. There are resources there. So when we were putting this presentation together some years ago with our law enforcement partners, they asked for a slide that would help them identify where the medications fell into classes, if you will, and into lethality. So we put this slide together. It is by no means inclusive of every medication that exists, but it gives you an idea of where they fall. So there's only 2 naturally occurring opiates that exist, morphine and codeine. And from there, everything else is either made or made to look like. When you heat morphine, you get an ester or a residue, right? And I want you to think about ranch salad dressing that you've left on a paper plate for a couple of hours. It kind of gets dry and crusty and not very appetizing. And that's where heroin comes from. Heroin is an ester of morphine. It's what's left over. And you get a medication called methyl disorphine. From there, we move to our semi-synthetic meds, which are the ones you're probably most familiar with. These are half lab created and half naturally occurring: Dilaudid, Norco, Percodan, Percocet, Opana. Buprenorphine we use in the treatment of addiction, which is a single product, buprenorphine, and its sister product, which is Suboxone, and that's a buprenorphine and naloxone component, right? So that's a combination medication that we use in the treatment. Synthetic meds, originally, these are all lab created, nothing natural about them. And the first one on the list is fentanyl, originally identified in 1958 as an anesthesia for surgery. A chemist was working in his lab and came up with this after mixing some things together. We now know that it's used for more evil than good, as I like to say, although it's still used as an anesthesia in surgery. Methadone is another medication we use in the treatment of addiction. Tramadol and tapentadol are great outpatient surgical meds, but the one I'll call your attention to on this list is loperamide. Loperamide is the chief ingredient in Imodium. And I know you're thinking, huh? Imodium? Yeah, Imodium. So when you look at the box, right, you will see there's a warning on the box that says, when not used as directed, may cause euphoria. And if you really don't know what that means, you think it means getting high, and it doesn't. All right. I've seen it crushed and injected, crushed and snorted. The only thing that's going to happen if you overuse Imodium is all kinds of digestive issues, bowel blockages, bowel blowouts, ileostomies and colostomies, potential coma and death. So if you are working with someone and some, you know, you see something out of the ordinary, or they're your employee and suddenly their attendance pattern looks different, potentially this is the problem. And then there's the naturally occurring opioids that show up when we do things we like to do: endorphins, enkephalins, dynorphines, and endomorphines, which are your the feel-good ones, right? So when we talk about naloxone, we have to talk about what is it exactly? What's the big deal? It's an opiate antagonist or an opiate blocker, which reverses overdoses in people. 4 methods of delivery include intravenous, which we leave for our EMS 911 first responders; intramuscular, which is syringe and vial. We do not distribute that. It's a lot of work. And we did a focus group some years back and realized even the nursing staff in a panic could not do that effectively. Subcutaneous administration, which is like insulin, right? So it's in the fatty layer of the skin. We don't use because it's not effective. It takes too long to see a response, and time is of the essence when we're using naloxone. And then intranasal naloxone, which is what we distribute and which we get from the state's naloxone distribution program. It only lives in the body about 20 to 90 minutes, although you don't have to wait that long between 2 doses, which we'll talk about in just a second. And then it causes what the manufacturer refers to as a sudden withdrawal in an opiate dependent person. Now, if you think of sudden as 3 to 5 minutes, then it's sudden. When I think of sudden as a nurse, I think instant. I want to give it, I want to see it. That is not the case here. You have to wait because it has to get into the receptors. It has to do its thing, kick it off, turn it over, and all of those things. But you'll have a few things to do in those few minutes that will make the time go really quickly. This is going to be the most important sentence that I say to you today. It does not get a person high. It is not addictive, and it cannot harm anyone where there's no opiate on board. So you just give it. If the person is unresponsive in one of your businesses, in your, if lobby or restroom or wherever your business might be, common area of a business, just give it. It's often referred to as the CPR for the 21st century, because when we started doing CPR in the 1970s, we did not know why people were unresponsive in parks and wherever else, right? We knew they didn't have a heart rate. We knew that they weren't breathing. We just knew they needed CPR. This is the same thing. If there's no opiate there, you are not going to hurt them. The body's going to metabolize the medication away. And I think that's really important to know. One, if you're not medically trained, what am I really doing here? And two, for my patients, right? Because sometimes they have issues with the law. They don't want to get in trouble. And so they don't want to do anything that will cause an issue. You cannot hurt anybody by giving them naloxone when there's no opiate there. Okay. And we'll talk about that some more. How do you recognize an overdose? By and large, people are not conscious. They're not awake. Right? So you tap the bottom of their foot. Hey, 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 are you okay? Are you okay? That sort of thing. If you are CPR certified, you know that. They're unresponsive to that outside stimulus. So tapping the foot, if you watch medical shows, you'll see a sternal rub, right? If you're doing a sternal rub, although I recommend not to do that. If you're outside, sometimes, some of our residents sleep outside and they could just be sleeping and you don't want to get hurt trying to help somebody else. So always tap them on the bottom of their foot. They may be awake, able to track you, but not able to speak to you because their speech center's been affected. So in this case, open or closed-ended questions are okay. Yes or no's. Did you fall? Thumbs up or thumbs down. Questions that can be answered with a head shake or a thumbs up or a thumbs down. Did you fall? Did you hit your head? Did you take something? Okay. Their breathing is short, shallow, erratic, or non-existent. Their pulse, if you know how to check it, here on your wrist or under the carotid, is slow or absent. The only thing you don't want to do is ever use your own thumb to check. It's your pulse in your thumb. So we don't want, any confusion there. You're going to look around the mouth. What we're looking for here is oxygen. And are they taking it in, right? So the mouth may be blue, gray, ashen, or discolored. If you're not sure, look at their fingernails, right? Around the fingernail will be the same blue, ashen color. If you're still not sure, because maybe your victim is wearing nail polish, gel polish, acrylic polish, or something else, look at their toenails. The skin around the toe will also be the same discoloration. You may hear a choking sound. In the back of the throat is called an agonal breath. They're not really exchanging air, but you think they are. So, but they're really not. So they need your assistance. And then they may have slack muscle. If you pick up their arm or leg, expecting them to engage the muscle when you let go, they cannot. It'll just drop to the ground. Okay. In any case, you would call 911, and we'll talk about that right now. So the one I'm going to call your attention to is the third bullet point there. You're going to start the chain of survival. So you recognize that something's happening. Call 911, tell them what you see. You don't need to know how to do CPR. It's okay. Just tell the dispatcher if you do or you don't. They'll help you with that. And deploy the first dose of Narcan. If CPR is needed and you know how to do that, leave your victim on their back and start CPR. If it's not needed, you're going to turn them in recovery position, which is illustrated on your screen there. Turn the person on their side, top leg bent in a 90-degree angle with their face parallel to the ground. Because if they vomit, we want them vomiting outward. The whole goal of this is to protect their airway and to have oxygen flowing, right? And if their airway is impeded, they're not really going to do that. The premise behind that is all of your major organs are in the medial line. So if you think about a straight line from the top of your head straight through the middle of you, that's where all your essential organs are, all of your major organs. So the body's job is to take all that oxygen from your extremities, hands, feet, legs, and move it back to the middle of you to protect you. Okay. So that's why everything gets sort of blue or gray. And then you'll monitor them until EMS gets to you. In Santa Clara County, from the top of Palo Alto to the bottom of Gilroy, we have a 10-minute and 59-second response time. So anywhere you are in the county, within about 10 minutes, EMS will be on the scene. And if you wait about 5 minutes between the deployment of 2 doses, which we'll do, I'm going to show you in just a second, EMS will be on the scene to help you. If you are fortunate enough to resuscitate after using 1 dose and the person you've resuscitated got up and left, don't chase them down. Just tell EMS what happened. They will take care of the rest. We don't want anybody hurt trying to help someone else, because everyone is allowed to decline or deny medical attention. And this is no different. Okay. I'm going to stop sharing my screen for just a second. Well, a few minutes probably, so that I can show you what your naloxone looks like. So this is what your box of naloxone looks like. Narcan is the brand name. Its generic name is naloxone hydrochloride. In this box, it's a 2-pack, and there's 2 4-milligram doses inside. And that can be used on anybody. Infant through adulthood, makes no difference, okay? You would use it the same way in an infant as you would for an adult. On the top of the box, lot number and expiration date. That's really important if EMS is asking you, did you use expired meds? And we'll talk about expired meds in just a minute. If you forget this conversation, because there's a lot going on, open the front of the box, and the instructions for use are right here. Now, also included in this box, which I'm happy to email you also, is it's a document, looks like this, 1 page. It's also how to use naloxone. So if your business, right, has a public restroom or a restroom that people can use and you want to post it there, you certainly can. If it's a business that you want it on the wall somewhere, you certainly can. You can just keep it with your first aid kit if you have one in your business as well. You don't have to post it at all. It's completely up to you. Inside the box, 2 individually packaged doses of naloxone look like this. On the bottom here, lot number and expiration date. Okay, really important again. And there's a reason that the manufacturer put it in all these places. And then when you open this, which I do a lot, the lot number and expiration date is right here on this black strip. Because when all of that adrenaline is pumping through you and you throw the box and you throw the wrapper, don't throw the applicator, because whatever you might need to give to EMS or to whomever needs it is contained on this applicator. Okay. So you put this part of the applicator in the nose. Either side, it doesn't make a difference. All right. And you push the red plunger. 1 applicator, 1 dose, no priming. So if I were to hit this red button, the medication would come out in a V-shaped pattern, which is very much like your face is shaped. Think about your nose being the straight line and the V part across your forehead. So the medication, even if someone is not breathing, goes into the nose and is absorbed there and sent out to all of the mu receptors that are in your brain, okay, and in the front of your head, which is where the overturning of the overdose will happen. And then you can tell EMS when they get on the scene what you did to help the person if they've left, whatever that might be. Now, in terms of expired meds, we get this a lot. And for a really long time, the answer was a little convoluted. As a nurse with a license, I am not allowed to use anything that's expired. So I make sure there's a lot of unexpired medication in the county. Now, for the average person, there is some literature that shows you can use the medication for up to 1 year post expiration date. We don't know how efficacious the medication is, but something is better than nothing. And we have discussed this at length with county council and with the district attorney's office, and the liability protections and the Good Samaritan laws still apply even if the medication is expired. And that's important to note because you've acted in good faith, right? You've tried to help the person wherever they might be, in your business, in the community, wherever that might be. So those protections will protect you even if the medication is expired for up to 1 year. Okay. We encourage you to have it if you have a first aid kit or an AED in your business, wherever that might be, to check. Here at the county, we do monthly checks of our first aid kit, whatever that might look like for you. Just take a peek at it. If you need a replacement kit, certainly let us know. We're happy to help you do that, right? If it's expired. How do you get rid of expired kits? Any pharmacy or hospital system that has a medication waste disposal. These just go right in there, okay? Dump, and they can take it off your hands. Let's see, let me go back to sharing this screen so I can finish the last 2 slides, answer your questions, and we'll talk about a couple of other things. Whoops. Let's see. All right. Can you see my screen? I don't think so.
No.
Okay. It's just the learning curve.
I did hear a case where a dog had been, some stray dog, poor thing, was drugged on purpose, and they rushed it to the vet, and they used Narcan on the animal, and they were able to save it, which was nice. You
can use naloxone on dogs and cats. It works the same way, and it works the same way. And let's see, I don't know what I did. It works the same way as it does in a human being, which is kind of nice, I think, because you can resuscitate then animals or whatever, whoever else might be affected, which is good. All right, hopefully, let's see if I bring it back up, you can now see it. Yeah,
you see your Outlook.
You see Outlook. How nice. You get to see all of my email messages. How about now?
Yes.
Okay. All right, so then let me go down here and change this. Thank you so much for the help there. So additional information. If somebody needs a referral to medication assisted treatment or for treatment in general, someone will call the behavioral health call center. That's how you can find us. You can call me directly. Lots of people on our conversation this morning know how to find me through county email, and you're welcome to do that. County AMT clinics, the phone number is there as well. The Santa Clara County Overdose Prevention Project is a community-based organization between all of us in the county, the 5 parts of county government, and all of you, the residents and citizens, business owners in Santa Clara. And we encourage you to join us. We meet the last Tuesday of the month for an hour. I will not shackle you to any chair if you decide it's not for you. But if you want to see what the county has been doing and our work, and maybe there's something that you need us to do, or you want input, or you want to be part of the process, by all means, send me an email and we will send you the meeting link. It can be a one and done, or you can join us. And we're happy for that. There's a lot of perspective that I don't have as a nurse that you do, because you deal with the public and you work in the community every day. I work in a clinic every day. So there's value in that. And then if you need to send Jasmine or myself an email for something, our email address is there as well. These are the resources that we typically use for additional information and that we give to patients. The CDC, NIDA, which is the National Institute for Drug Abuse and Awareness. There's all kinds of literature and resources that are there. Song for Charlie is a grassroots organization that was founded by a family who lost their son from Santa Clara University to an overdose. And they have spearheaded a great organization, and we partner together on a lot of things. And then the Behavioral Health Services website at the new county website as well. That's a thank you there. And then I want to talk to you just briefly before I answer your questions about the chocolate chip cookie theory. So what we know about this is that there is no quality assurance program for drug dealers. No one is saying, I took a pound of flour, a pound of sugar, a cup of water, and a pound of fentanyl, and I mixed it all in a bowl, and I laid it out in a mold, and every pill got exactly the same amount. Not happening. It's the chocolate chip cookie theory. If you make chocolate chip cookies, all the chips sometimes end up down here. And that's great for me because I don't really like those. But if you are a person who wants their chocolate chips in their cookie, you want it to be all around. The problem when we buy medications outside normal channels, which is a pharmacy, from a brown bottle with your name on the label, is that you don't know where the fentanyl is. You don't know where it is in the pill. It can be all in one corner of the pill. It can be evenly dispersed. And if you break that pill in half or in a corner or in thirds or whatever, you don't really know. And we've had situations where one bar of Xanax was purchased, broken into 4 pieces, 3 people had no effect, and 1 person got everything. Okay, so another consequence to purchasing illicit or illegally acquired medication is that you don't know. And it's in everything. Fentanyl is being cut into everything that we know about. Cocaine, marijuana, methamphetamines, ADHD meds, right? That are not acquired from a pharmacy, places like that. Okay, so it's important to have conversations with, you know, young people perhaps in your own life, you know, whether they're your children, your grandchildren, nieces and nephews, whatever, about the dangers of buying things on Snapchat. If your business happens to be a business that focuses on, and when I say young people, 30 and below, is that conversation. Those are some of the things that, you know, that can be brought up about where medications are being purchased and what's really going on with that. So questions for me?
Wow. I was going to say, thank you so much for all that. I think we could have gone on another 30 minutes to another hour of this presentation. And thank you for talking about the cookie method. I saw a documentary, I think, where it's like he didn't ask for fentanyl because a kid had asked for like Xanax or something, and 1 pill, and it was just cut by some person in their garage, and unfortunately he passed away. So thank you for talking about that. We have time for maybe like 2 questions maybe. Is there anything urgent anyone really wants to ask? Feel free to take yourself off of mute. Michael, go ahead.
Me, you got me? All right. Given my age and my demographic, I'm more likely to encounter a person with a heart attack or a stroke. Are there risks of sort of misapplying Narcan to that person and vice versa?
Not at all.
Not at all.
Nope.
Okay.
Mm-mm.
And I think you addressed this, Anjanette, but I want to make sure speaking of the drugs that were made in someone's backyard or something that are synthetic, and therefore it's kind of mixed ingredients. This Narcan, and I can't pronounce. I work in the hospital, but I can never pronounce actual medication.
Naloxone.
It can still be used to help potentially save that life, regardless of what the ingredients are in that drug.
Yeah, okay. As long as there's an opiate in there, yep,
Awesome.
It will help. Absolutely.
Abby, go ahead.
Hi, first of all, I want to thank you. And I think everybody on that call, if it was legal, would have voted 2 or 3 times for our Joe. However, I have the local hotel, and while typical clientele might not be a drug user, they might bring someone. And I think this is so relevant, so important. Kim, are you going to end up with this so that we can get them from you? And then what is typically a length of time between receiving an expiration? I mean, is Narcan good for 1 year, 2 years, 3 years,
3.
6 months?
3
years. Okay.
Yeah,
So
3
that
years.
we can calendarize to double check.
Yes.
Appreciate that very much. Thank you.
Yes, and to answer your question, Abby, I think this is, you know, it's very important, I think, to our community and would be necessary for us to have access to these kits for our business owners, you know, restaurants. I think anyone who's interested in being trained and having it on hand should have access. So however we can facilitate that, having them available here in our office, we can, you know, communicate that to our membership, et cetera. Very happy to do so.
There is one second, Diana, before you drop Jasmine's hand. There is an effort by Scoop right now to outreach to restaurants in our communities, right, across the county. And we've met with a little bit of resistance because, you know, by and large, people don't want to acknowledge that that's happening. And we understand. So we're sort of retooling it. We will take it from a first aid perspective instead of, you know, drug overdose. So if there are restaurants that reach out to you that are interested, by all means, please let me know. We will come to the restaurant, do the training, leave the kits for them, you know, on our time. So we just want everyone to have what they need. You can go ahead, Diane. Sure.
Thank you, Anjanette. Jasmine.
Hi, again, I'm Jasmine. I work with Anjanette, and I just kind of wanted to chime in that if there are people that are looking to have naloxone in their homes, we do have a mail order program that Anjanette and I have put together. We started it December 1st of last year, and we have sent out over 2,500 kits of naloxone via mail. So if anybody's interested, you can just email us at our Scoop email, and we can get that, you know, set up for you guys. Or if you have anybody that is interested, you can give them our email. Again, all you would have to do is just send us your preferred mailing address, and we can get that out to you, 2 kits and some extra paper information. So I just wanted to put that in the air.
Thank you, Jasmine. And I know we're going to try and share this information far and wide, but for the folks in the call, Jasmine, if you wouldn't mind putting the email of Scoop in the chat box, that'll probably be really appreciated. Sure. And I really want to thank you, Anjanette, because I think this is really, it's a scary conversation to have. And in my mind, when I think about potentially waking up someone who's having a drug overdose, the first image that comes to my mind is that Pulp Fiction scene, you know, where he's like jabbing, and then the person wakes up, and you don't know how the person's going to react when they get revived, I guess. That's a very scary thing for any person on just walking by or just wanting to help somebody think about. So this was a really great open conversation, and I appreciate you making yourself available, and you and your team and everyone at the county. So I just want to thank Kim and Joe and Anjanette for bringing us together for Los Altos, and keep doing the good work of spreading the message, and we'll do what we can in our end. Kathy, not to put you on the spot, but this might be a really interesting KMVT kind of thing to promote. So just putting it out there.
Yeah. No, I agree. I was sitting here going through this, and I have a family that's very involved in law enforcement. So I have heard about a lot of their things that they've been involved in. And I think just getting this message out, just how simple it is to help. Mm-hmm. I had no idea. So I think, yes, I agree, Diana, that the more we can do to get the word out, the better.
Yeah. In the last minute, I know, Kim, you're going to have an announcement of what's coming up at the chamber, but Supervisor Simitian or Anjanette, any final comments you want to make to the group?
I'll defer to the supervisor. I have nothing else.
Thanks, Anjanette. And I'll ask Anjanette to nod and smile if I get it right. I think you heard this, but the 2 points that I want to underscore are the folks who are sort of hesitant to get involved should feel really comfortable that California's Good Samaritan laws do not put you at risk. Right. So the notion of, oh, I shouldn't get involved, no, it's there. The protection is there. You can get involved and not feel like you put yourself at risk. And the second thing is the question that we got and was answered is, you know, people are worried, well, is there something I can do wrong? And what Anjanette is saying is not really. You know, if it works, it's a lifesaver. And if it doesn't work, no harm. So, you know, those are the 2 things I would sort of make top of mind as we all leave the conversation again, which always impresses me when we have it is, you know, you are not putting yourself at risk by engaging. The law is there to protect you, and you really can't do it, quote, harmfully. It'll either work or it won't. Okay. And thanks again, everybody. I do think, you know, this will be even more valuable if we can use it as the basis to keep spreading the word and have the understanding grow and grow, as a couple of you have alluded to. I got to hop off for my 10 o'clock. I'm guessing you do too. Thanks all.
Thank you, Joe.
Thanks, everybody.
Thank you, Supervisor.
Kim, do you want to make a quick announcement? What's coming up at the chamber?
Sure. Just 2 quick items. Our State of the Cities luncheon is April 26th. We'd love to have you join us. Supervisor Simitian will be there. Malia Cohen, our state controller, is also joining us and will say a few words as well. So we're very excited to have her join us this year. And then we have a new member breakfast on May 7th. So if you know anyone that you'd like to invite to join the chamber, we'd love to have them join us in May. And those are the only two things I have for you today. So thank you. Really appreciate your joining us for this session. We will work with the county to make kits available here at the office and to our businesses as well. So thank you so much to the county team. Thank you, Anjanette, and for sharing this incredibly important information.
Thank you, everyone. 10:01. We are practically on time. Enjoy the rest of your day. Thank you all.
Bye. Thanks,
All
Megan.
right.
Bye.
Thank you. I'll
Thanks,
keep this open if you need to grab the email address, anyone. Thank you, Michael. Okay.